we, as I said, are very grateful for this time because we wanted to discuss specifically why this was hurtful and what our community has been experiencing over the past 2 years. And it sounds like you have some experience from that, but it's very different from a provider perspective than it is from being a person with lived experience and being a person with a disability. We're not here really to soothe our own feelings, but we feel that the CDC really needs to take steps to re-earn the trust of the disability community, not based exclusively on your comments, but based on policy actions over the past 2 years. And we want to establish a couple of things at the beginning, and we appreciate you expressing that you apologize for this being hurt. For any folks that did feel hurt. We understand you were referring to a study. We understand that your remarks were cut by the network and that others have taken them out of context. And we know that that must have been challenging in many ways. But the study you were referring to, we represent the folks in that study who died. And those people with 4 or more comorbidities, those lives remain at risk at this point because of Omicron. And throughout the pandemic, we have been the folks who have died. So I really want to turn it over to Matt and to Julia and to Elena and Natalie to talk a little bit more about the experiences we've seen over the past 2 years. And then I'll go ahead and we can turn it over to some of the more concrete policy asks we have. But I'll start by kicking it over to Matt.
Thank you. My name is Matthew Cortland. Thank you all for being here today. I am a senior fellow at Data for Progress, where I focus on chronic illness and disability. At the outset, I want to apologize if I'm not at my best right now. My partner has COVID-19 and is isolating in the other end of our home. And as I am up at night listening to her cough, as someone, she has 3 or more chronic health conditions, comorbidities, 4 or more actually comorbidities. I worry about her because her life matters a great deal to me. And I know that she's up at night worrying about me getting sick because I am also one of the tens of millions of Americans with 4 or more comorbidities, and I'm immunocompromised. I don't want to debate specific prevalence studies, but about 3% of Americans, including children and adults, are immunocompromised. We are literally millions of people. I appreciate your apology. I understand that to some extent your remarks were taken out of context, but it is not at all encouraging to us or our loved ones that COVID-19 mortality amongst the vaccinated is falling disproportionately on those who are medically complex, who are immunocompromised, who are disabled, who are chronically ill. With that, I'll turn this over to Julia. Thank you again for being here.
Thanks, Matt, and thank you, Director. I'm also a person with 4 high-risk conditions for COVID and many other co-occurring conditions. I represent the Autistic Self-Advocacy Network, which means I represent a community where people are already at high risk, and it's common to additionally have multiple other disabilities and risk factors. What people with disabilities have heard consistently over the course of the pandemic is that our deaths are expected, inevitable, and less tragic than the deaths of other people. And we heard this message prior to the pandemic as well. We know it's actually the default implicit belief that most people have about people with disabilities. And sometimes this belief is expressed directly through words, but often it's expressed through actions like policy choices or through an absence of action. And over the past 2 years, what I've seen from my community is that many disabled people have looked at the policies put forth by the CDC and have been forced to conclude that the position of the CDC is that it matters less when we die. When you were talking about the deaths of people like me and you dismissed us as being unwell to begin with, you were saying what we've heard loud and clear for 2 years. I also really appreciate the apology, and I think the disability community will too. But we're going to need to see that apology really translated into those policy actions, and I'm hoping we can spend the majority of our time talking about that. Thank you. I'm going to pass it to Natalie.
Good afternoon. I'm Natalie Kean, and I'm here today on behalf of Justice and Aging and the older adults in our communities that have heard this message too, that their deaths are inevitable and their lives are not valued. And this is especially true for older adults with disabilities and for communities of color who are losing their elders because policy choices are not valuing their lives. So many of the people with multiple chronic conditions in the study you were referring to and in our country are older adults themselves, and people with disabilities age, and we need to keep that in mind. This is not a monolith, and we need to take specific targeted actions with our policies. And that's what we're here to ask for today. Elena?
Thank you. Thank you, Natalie. Thank you. I am Elena Hung. I am here on behalf of Little Lobbyists, a family-led group advocating for children with complex medical needs and disabilities. And in addition to what the others have already said, I want to know, Dr. Walensky, that both your comment and your policy choices as director are also extremely damaging to chronically ill and disabled children who I assure you are watching and listening. I'm a mom to an amazing 7-year-old disabled daughter. Xiomara was born with a number of serious medical conditions, including lung disease and chronic kidney disease. And Xiomara is the reason that I do this work. She and I have worked together for several years now to help make policies more inclusive and accessible for kids like her. And your comments and your policy choices conducted in your leadership role as part of this administration undermine the work that we are doing to raise our children, our disabled children, to see that their lives are worthy. It undermines the work that I'm doing as a parent, the work that my organization is doing across the country, and the work that the disability community as a whole is doing to ensure that kids like mine get a chance to grow up. So when chronically ill and disabled people are dying at disproportionate rates, and the CDC is telling chronically ill and disabled children that that is their fate, and that is the part of the harm that is being done here that I wanted to raise for your awareness.